Good afternoon. It's Tuesday, December 8th. I'm Milton Walker with the Midday News. A special welcome if you are watching on onespotmedia.com. U.S. regulators have confirmed the Pfizer-BioNTech COVID-19 vaccine is 95% effective, paving the way for it to be approved for emergency use. The Food and Drug Administration, the FDA, found no safety concerns to stop approval of the vaccine. It's the first time this level of detail for the shot, which the UK started using for mass vaccination today, has been published. The FDA will meet on Thursday to make a formal decision. Meanwhile, U.S. President Donald Trump has long touted America's first mantra. On Tuesday, senior White House officials told CNN that the president is expected to take action related to COVID-19 in what they call a reaffirmation of that mentality. More from the CNN.
President Trump is expected to sign an executive order that prioritizes the shipment of the COVID-19 vaccine to Americans ahead of other nations, says senior administration officials who spoke to CNN. This comes as health experts say a post-Thanksgiving surge is starting to blanket the country.
We're going to see increases in hospitalizations, and hospitals are already on the brink. So where is the reserve capacity? Where are patients going to be going at this point?
According to the New York Times, after initially purchasing 100 million doses of the vaccines, the Trump administration turned down an offer from drug maker Pfizer to buy more doses of the vaccine in late summer.
The good news is that there are more in the pipeline, and we also have other means in place whereby the U.S. can potentially procure additional doses, including from international cooperatives that exist for this very reason.
Administration officials deny the Times' story, which reported the decision to not buy additional doses from Pfizer might mean the U.S. won't be able to get more doses from them until June because of the company's commitments to other countries.
And a British grandmother became the first person in the world to be given the Pfizer COVID-19 jab as part of a mass vaccination program. She was given the injection this morning, the first of 800,000 doses of the Pfizer-BioNTech vaccine, which will be dispensed in the coming weeks. Up to 4 million more are expected by the end of the month. More from the CNN.
First of all, I'd like to take a moment to acknowledge what happened at 6:31 a.m. local time this morning in Coventry in England. And that is Maggie Keenan. You said her name earlier, the very first patient to receive the first of those 2 doses that she'll be needing to be immunized against the coronavirus. It is, I think, the happiest news that I've been privileged to report since the beginning of this pandemic. She is said to be an early riser, Margaret Keenan. She has 2 children, 4 grandchildren. And she says she spent most of the year alone and that she looks forward to being immunized so that she can finally see her friends and family next year. Sadly, she won't be immunized by Christmas because first jab today, 21 days before she gets the next jab, and then 7 to 10 days before she actually, her body develops the full immunity or close to full immunity. So that takes us into early next year. Still, she says, if I'm 90 years old and I can do this, you can too. And she recommends that everybody who is offered this vaccine should get it. And people are being offered the vaccine in 50 hospital centres, such as this one, Guy's Hospital in central London, 50 hospital centres across England. There are others, obviously, across the UK. And what's happening is that patients, 80-year-olds and above, who had been booked into the hospital for today for another appointment, or patients who were in hospital and were going to be discharged, those patients will be offered the vaccine as a matter of priority.
Meanwhile, the Medical Association of Jamaica, the MHA, says local authorities should closely monitor the UK's COVID-19 vaccination program. President of the association, Dr. Andrew Manning, says the information gathered will help to guide the rollout of the vaccine in Jamaica.
We need to be looking at not just the UK, but all other jurisdictions which are introducing the vaccines. The UK has been going a little bit faster than in the US, which is taking a slightly longer approach, I think, in terms of looking at the experience. And one of the things we need to consider in our jurisdiction, looking at these trials, is the safety profile, how effective the vaccine will be, how from a logistic point of view, a particular vaccine will be useful in our local context.
Jamaica is scheduled to start receiving the first dose of the COVID-19 vaccine between April and June next year. 87 new COVID-19 cases have been recorded in Jamaica. This has increased the country's case count to 11,271. Most of the cases were reported in Westmoreland and St. Anne, followed by St. James. The country's COVID-19 death toll remains at 265, as no fatalities were recorded for a second consecutive day. However, the Ministry of Health says a death is being investigated. Two new reports have found that the COVID-19 pandemic-related school closures risk pushing an additional 72 million primary school-aged children, including those in the Caribbean, into learning poverty. This means they are unable to read and understand a simple text by age 10. The report by the World Bank outlines a new vision for learning and the investments and policies, including education technology, that countries can implement to realize this vision. The Washington-based financial institution said the COVID-19 pandemic is amplifying the global learning crisis that already existed. The bank said the pandemic could cause an increase in the poverty percentage of primary school-aged children in low and middle-income countries who are unable to read and understand a simple text from 63% to 63% from 53%. The bank says it puts this generation of students at risk of losing about $10 trillion in future lifetime earnings, an amount equivalent to almost 10% of global gross domestic product. It's time for a break. Stay with us. More stories when we return.
It's the most.
Welcome back. Continuing the news. The COVID-19 pandemic has significantly impacted the teaching and learning process across the island, but it's also presented an opportunity to remedy some of the shortfalls it may have caused. That's the view of at least one professional in the education sector who spoke on TVJ's Smile Jamaica this morning.
Last week, the Ministry of Education disclosed that average scores for students from grade 4 to 6 were way below 50% across all subject areas on which they were tested. According to retired Permanent Secretary in the Ministry of Education, Elaine Foster Allen, this highlights a significant gap in the new teaching and learning process.
If there are gaps in knowledge, then there's an indication that teachers may not have grasped the content and the learning objectives in such a way that they can teach those objectives or teach to those learning objectives and the content with confidence.
She adds that it is important to address the gap identified among grades 4 to 6 students. Mrs. Foster Allen explains that each school has access to an interpretation document which can be used as a guide to identify the gaps in the various subject areas and fix them accordingly.
What the principal and the teachers ought to be doing they should be looking at the score against each item. How did children do on this item? Did they do well enough? Why didn't they do well enough? Where are the gaps in learning in this particular area of the curriculum? And begin to reteach, maybe undo some of the preconceptions that the children had and teach the thing properly.
Since the COVID-19 pandemic hit Jamaica, schools across the island have been utilizing the virtual spaces, which the retired Permanent Secretary believes present a great opportunity. She suggests that schools virtually collaborate across the system for core subjects.
It is a great opportunity for the schools to say, look here, we have a great teacher of math, of primary math in this school. We can put on, an opportunity for your children in your school to join with our children in my school to get it right.
Mrs. Foster Allen was speaking on Tuesday morning on TVJ's Smile Jamaica program. Now, starting this month, the Education Ministry is proposing to spend $173.4 million on a remedial intervention program. O'Shane Masters, TVJ News.
And the parliamentary opposition is concerned that not enough attention is being paid to students at the primary and secondary levels as more schools reopen for face-to-face classes amid the COVID-19 pandemic. Spokesman on Education Dr. Angela Brown-Burke says while students in upper grades are being targeted, others are being left behind.
What the government revealed to us is the learning loss in those grades that they are targeting, because 4, 5, and 6 was a part of those grades that were being targeted. And whatever we're doing was actually aimed at those grades. I shudder to imagine what the learning loss is in grades 1, 2, and 3, 7, 8, and 9. We haven't really heard about those either. I've always been concerned that I'm not so sure what's happening in education as a whole.
Dr. Brown-Burke wants the Education Ministry to outline plans for the inclusion of all students.
We were just picking out these grades, and I understand why we would want to focus on those grades, but those are not the only children who are in school, those are not the only children who are being left behind, and those are not the only families that really and truly are almost at sea. You know, I talk to parents all the time who just don't know what's happening, and that for me is a great concern.
The Deputy Chief Health Inspector for St. Mary, Rupert Stevens, has announced new plans to tackle the issue of dengue in the parish. Speaking at the monthly meeting of the Municipal Corporation recently, he says the Health Department is ramping up new measures to prevent a possible dengue outbreak.
So what we'll be doing in the daytime is that we're stepping up the search and destroy. That is inspecting homes, identifying mosquito breeding, treating the breeding, destroying the breeding sites, addressing the issue of the drains, treating with the drains, and anywhere there is accumulation.
The Ministry of Health, with the support of the Pan American Health Organization, PAHO, has embarked on a retrofitting project to increase the resilience of health centers across the country to withstand environmental threats such as hurricanes. Port Antonio Health Center in Portland is the first to benefit from this initiative. Shamela Pullin reports.
For many years, there has been talk about making health facilities across Jamaica climate resilient. This is because whenever it rains heavily, several facilities would be flooded or damaged, thereby affecting the delivery of health care. But that could soon be a thing of the past. On Thursday, the Health Ministry, the Pan American Health Organization PAHO, and the British High Commission in Jamaica launched the Smart Healthcare Facilities in the Caribbean project at the Port Antonio Health Center. The Port Antonio Health Center will be redesigned and retrofitted to withstand hurricane and other weather conditions.
It is a facility that will see, I am assuming, rainwater harvesting, use of light as opposed to energy that you have to purchase, the need for airflow that doesn't require or is in keeping with proper infection prevention and control.
Port Antonio is the first of 4 health centers to benefit from this program. Over 200 people in Portland have started to benefit from this project. PAHO, through the United Kingdom aid, donated $1.3 million to the Jamaican government to fund this project.
146 people from a range of disciplines in Jamaica are trained to do the audit that brought us here to this project itself. Now, what we're also doing is that the findings of these 146 facilities that have been assessed are being made available to the Health Ministry so that they can then decide about their priorities in what can be fixed, what investment is needed, and how maybe all of the high priority needs can eventually be met.
Meanwhile, Member of Parliament for East Portland, Anne-Marie Vaz, says this is a major step in the battle to manage the effects of climate change.
My hope is that other institutions will take note of this and try to employ their own mitigation methods for their facilities and their everyday activities, as the devastating impact of climate change not only affects us all here in Jamaica, but across the world.
Shamela Pullin, TVJ News.
The Met Service says a cold front entering the northwest Caribbean is forecast to move across Jamaica tonight. There will be periods of showers and cooler winds, mainly over northern parishes and coastal waters, and will impact other areas of the island. This will continue until Friday. Authorities in the Clarendon capital, Maypen, may have their hands full this festive season. Some vendors have already begun to occupy no vending zones to sell their wares.
No vending will be allowed on any sidewalk.
The message is clear. The sidewalks and streets of Maypen in Clarendon are no vending zones. But are the vendors even listening? In some instances, the answer is no. We observe selling and buying along some roadways in the parish capital. Even vendors who say they have been following the rules by staying inside the designated vending zones are getting desperate. They say sales have been slow, especially since the pandemic hit.
Sometimes I have to pick up my things and go out on the street to get them sell. Which in way, if everybody they come in, everybody would sell, right?
But the mayor of Maypen, Winston Mirage, says allowing vending on the streets will be bad for rule of law and public health. In addition to the obvious traffic issues that street vending can cause, allowing vending along the roadways will also encourage overcrowding, which is an even bigger problem with COVID-19 around.
They are paying for the space in the market. If you look at that receipt that they get from us here, it is marked clearly market, not Muir Park Avenue, not Main Street, not any roadway, not 7th Road. It says market, means that you are to vend in the market.
In sports, two local sports medicine specialists have varying views on the implications of the abandoned series between England and South Africa in terms of what it may have on international cricket going forward. Renaldo Brown reports.
The series between South Africa and England has been the first to be called off to positive COVID-19 results from players since international cricket resumed following the shutdown caused by the pandemic. Noted physician Dr. Paul Wright asserts that this could become an issue if persons involved directly and indirectly with biosecure bubbles are not tested frequently.
I really think so. When you look at sports across the world and what has been happening with cancellations, postponements due to the people who are participating testing positive. So this is going to be a problem that has to be solved by A, money, and B, adherence to discipline in how you look at it.
However, Dr. Akshay Mansingh, who is a member of the West Indies Medical Committee, believes the unfortunate situation in South Africa should not undo the good work done by other countries in hosting series.
Well, it'd be unfortunate if one incident is going to mar what's happened in the other 7 that I mentioned to you. But the reality is that in each bubble, in each sort of scenario, the hotel workers have been treated differently. What I mean by that is that in some of the bubbles, they were actually tested and kept inside of the bubble. In other scenarios, they were tested but kept isolated, and the contact was minimal between players and the hotel staff. So I think what it will require is a more stringent look at how contact is made and interactions between those who are playing and touring and those who are local hosts, meaning, groundsmen and hotel staff and so on.
Mansingh, who recently visited Bangladesh to approve protocols ahead of the West Indies tour in January, says the ability of countries with a high infection rate to host series should not be affected.
Well, I can't think for the players, but what I will tell you is that the whole concept of the bubble is that you're actually not coming into contact, no matter how high the incidence is in those countries. So the important thing is to ensure that all protocols from the time you arrive till the time you leave, all protocols regarding people you come into contact with, adhere to the principles of biosecure bubble. And if that's the case, then honestly, I don't think it's a major risk wherever you go.
CWI's board of directors is set to make a decision on whether the West Indies will tour Bangladesh in January come this Thursday. Renardo Brown for TVJ Sports.
And that's the midday news. I'm Milton Walker. Join us at 7 for primetime news on behalf of the news, sports and production teams. Good afternoon.